And it goes a little something like.
Good afternoon, ma'am. I'm Nurse Kristel and I am your nurse for today. Ma'am, may I know what is your name?
Annabel Gigante,
How about your age, ma'am?
41 years old.
Okay, before doing the procedure, always perform respiratory assessment first in your client. Okay, and then observe for behavioral changes also, and observe for patent airway and remove airway secretions by having patient cough or by suctioning. And of course, don't forget to ask permission in your client to cough. Okay, ma'am, can you please cough? Okay, ma'am, thank you so much. After coughing, note patient's most recent ABG results or SpO2 value. And then lastly, don't forget to review patient's medical record for order of oxygen. For the planning, you need to identify the expected outcomes for your patient. And for this procedure, we will be doing the administration of oxygen. And the goal of this therapy is to maintain normal hemoglobin saturation so as to facilitate normal oxygen delivery to peripheral tissues. Next, explain the procedure to your patient and to the family or to the significant others the procedures that you will going to do to your patient. And then lastly, you need to gather all the equipments that you will going to use and complete necessary charges. And then ask permission to your client that you need to leave her for a while so that you can accomplish all the equipments that you will going to use to her or him. So, ma'am, please allow me to go outside to get all the equipments that I will going to use. Is it okay with you, ma'am? Okay, ma'am, thank you so much. And for this procedure, we will going to use the nasal cannula and the face mask as our equipment. Ma'am, please allow me to close the curtains for your privacy. Is it okay with you? Okay, thank you, ma'am. Close the curtains. And then perform the hand hygiene. And then wear the clean gloves. Okay. And then wear also the face shield if indicated. And then after it, adjust bed to appropriate height, lowered side rails, and check locks on bed wheels. And then attach the oxygen delivery device to oxygen tubing. Attach it to the humidified oxygen source adjusted to prescribed flow rate. And then apply the oxygen device now. We will going to use the nasal cannula first, and then attach the tubing first to the oxygen source, and then place tips of cannula into patient's ears, loop tubing over patient's ears, assuming that there is a tips of cannula here, and then adjust the lanyard. Okay, that's it, adjust. And then next, we will going to use the face mask. Attach it first, the tubing, to the humidified oxygen source. And then you can now apply the mask over the patient's mouth and nose. And then don't forget to brought the straps overhead. And then that's it. And then maintain sufficient lock on oxygen tubing secured to patient's clothes. We will going to use the micropore here to secure. And then observe the proper function of oxygen delivery device. And then verified setting on flow meter and oxygen source for proper setup and prescribed flow rate. And then of course, don't forget to check the cannula or the mask every 8 hours and keep the humidification container filled at all times. And then post the oxygen in use signs as needed. Okay? And then that's it. You can now ask to your patient for your permission to leave. Okay, ma'am, may I go out first for a while? Okay, thank you, ma'am. And then, after it, you can now dispose the gloves properly. Okay, and then do the proper hand hygiene. You can now remove also the face shield. And for the evaluation, you can now monitor your patient's response to changes in flow rate with SpO2. And then you can now observe the improvement of your patient in physical signs and symptoms. Okay? Observe. And then assess the adequacy of oxygen flow each shift. Don't forget the meter or the flow meter. And then don't forget to observe your patient's ears, nose, nares, and nasal mucous membranes for evidence of skin breakdown. And then you can now ask your patient to explain why oxygen is beneficial. Ma'am, can I ask you a question? Ma'am, for you, what is the beneficial of having a good oxygen in your body or in your life?
Para sa akin, yung beneficial ng oxygen, primarily needs ng lahat ng tao. Tapos, yung mga ibang bagay, kailangan din ng oxygen. Kung walang oxygen, siguro, hindi tayo mabubuhay.
Okay, ma'am. Thank you so much. And then, of course, as a nurse, don't forget to identify all the unexpected outcomes to your patient. And then the last thing that you need to do is to record all the pertinent informations in your appropriate log. And then document the evaluation of patient learning and report the unexpected outcomes to healthcare provider or nurse in charge.